Welcome to the Learnskin podcast with Dr. Raja and Dr. Dejarra, where they discuss all things skin. Skin is fascinating because it affects us in so many ways, like our health, psychology, and how we connect with those around us. This podcast delves into the art and science of skincare. A short disclaimer before we get to the good stuff. Dr. Raja Sivamani and Dr. Dejarra Levtov are board-certified dermatologists. This podcast is meant for educational and informational purposes only. All opinions shared do not express the views of Learnskin. Neither this podcast nor any information contained within it are a substitute for professional care by a doctor or other qualified medical professional. This podcast does not constitute medical or other professional advice or services.
Hey Raja, how are you today?
Dejarra, it's podcast time.
Ooh, I'm buzzing with excitement. Can you tell us what we're in for today?
Yeah, today I'm really excited because we're talking to a naturopathic doctor who also sees a lot of dermatology patients. I think if you haven't heard of her yet, you're going to hear a lot about her because she is really taking form in the naturopathic world, and we're going to be bringing her to the Integrative Dermatology Symposium. So I'd like to introduce Dr. Dejarra Sims. Dejarra, welcome to our podcast. We're really excited to have you.
Welcome.
Thank you so much. Thank you for having me.
I'm going to do a little bit of bragging about you really quick before I let you brag too, because
oh, embarrass her, please do.
Oh,
yes.
Please don't. Oh, please, no.
So let me start by saying you have had such a rich background. She completed her doctorate at Southwest College of Naturopathic Medicine, great school down in Arizona. And she's core faculty at Bastyr University in Southern California. And then she's also teaching naturopathic dermatology, advanced business practices. Now, first of all, if you're teaching that course, we need you in all the medical schools too, because none of us really learn any business acumen, I would say, until you kind of do it on your own.
Exactly.
And focuses on a wide variety of diseases, but you have been focusing on skin diseases, digestive disorders, and then also primary care. And I know that you have this interest in community medicine too. So I feel like you have this full package of understanding where people are coming from, where they're trying to go. And not only that, if that training wasn't enough for you, Dejarra, she's also done some additional training in traditional Chinese medicine and acupuncture, minor surgery, and osteopathic manipulation. So I think we can pretty much
package
anything today, and we're going to be good to go.
That's fantastic. Yes, welcome. So Dejarra, what I wanted to do maybe, you had such a broad take on training and the alternative sphere, if you will. Could you tell us a little bit about the training for naturopathy? Because I often get that confusion from people I talk to or even myself. What is the naturopathic training involves, and what are the strengths that a naturopath brings to the table when it comes to managing patients?
Oh, that's such a great question because people do confuse naturopaths and with homeopaths. And we do homeopathy. We practice homeopathy, but that's just one modality. So a naturopathic doctor goes to a naturopathic medical school, which is a full 4-year medical education. And we're trained as general practitioners that do outpatient care. There is no hospital training with naturopathic doctors unless some schools might have something special set up with local hospitals, but the basics of naturopathic care is outpatient general medicine. And we use that training that we have in school to help people with all kinds of chronic diseases and acute conditions. But we start off with a look at their diet and lifestyle, looking at just obstacles to cure. What are they eating? What are they doing? And helping them with nutritional supplementation. And then we have these modalities where we can add in, such as using hydrotherapy, botanical medicine, which is herbal medicine, using the herbs, which, as we know, a lot of our medications come from herbs. So we use the plants and we use food. And we generally just listen to our patients and spend from 60 minutes to 90 minutes doing a medical intake. And I think that's one of our greatest strengths is because we have such a long time to talk to our patients. We can pick up on things that some doctors may miss, not because their heart isn't there and not because they're not trying to help the patient, just because we spend 90 minutes with the patient, you just kind of figure out some things that someone may have missed. So I think that's the biggest strength of naturopathic medicine is that we have an opportunity to actually listen and get great timelines, take a great history, do a great physical exam, because you can do a lot in an hour, right? And
Oh
I
my
wish
God, if we had an hour, right, Hadar, like it's like
Oh my God.
that
Oh
would
my
be
God, yes.
a
if you
lot
had
of
an hour, you would save the world, right? You could you could save their life, save
time.
their lives of their parents, their children. You
No,
just
Well,
have
you
some.
know the good old joke, Raja. If you want to have 25 hours in the day, all you got to do is wake up 1 hour early.
Oh, well,
only during daylight savings, though. Dang it, they didn't tell us that aspect of it.
so
Well,
yeah.
Dejarra, just jumping into that a bit more, because you're right. I mean, having 60 to 90 minutes, how remarkable is that? So can you talk about what are some of the ways that, and you can build in some of the dermatology experiences that you're having. How do you talk about things like, what are the things that you're trying to pull out of the history? What are the specific things that you're looking for that will help you understand how you're going to approach treatment?
The first thing, I mean, like all doctors, I'm going to ask, when did it start, and get a great timeline. But I think what makes it a little bit different is a lot of times doctors will focus on the most recent rash or the most recent acne outbreak. And I get that information, but I also ask them about the very first time they had any skin issues in general. So I will go back, as far as like, oh, my mom told me when I was a baby, I used to scratch all the time, because we have to understand, of course, that allergic triad and making sure, did they have eczema? Did they have allergies? Did they have any type of issues as a child? And also, like, what was their parents' skin like? Looking at their history. And also, I think one of the greatest things that I focus on as a naturopath is their diet. Like, what is your digestion like? What are you eating, and how is it affecting you? Do you have constipation, diarrhea? Do you have digestive issues? Because I can promise you about 95% of my patients have digestive issues if they have skin rashes. And it started a long time ago, and they just don't make the connection. And that, gut skin connection, it's a lot of research coming out on that, and it's real. And patients don't realize that they have to use the bathroom and have bowel movements every day. And a lot
Yeah.
of them don't.
Yeah, it's true. It's very true. So when you start talking about assessing diet and basically kind of their gut function too, in many ways, their gut health,
Hmm.
that's clearly unique. And so when you're talking about diet, are there particular things that you like to start looking at when you're thinking about, I mean, let's take acne, for example. Are there particular things that as an example, that you're looking for in their diet, or particular imbalances in their gut health that you think are remarkable?
Yes, especially with acne, because one of the things people have a misconception that it's always one food. And I want to, even, naturopathic doctors, they're always like, oh, we got to take away gluten, got to take away dairy. Right. And there's a lot of research that says, okay, well, there's people that have, sensitivities to gluten, and a lot of research about sensitivities to dairy, but it's not always those things. So I have to start off with a diet diary, and I actually have my patients write down what they put in their mouth every day for 2 weeks, and they have to put the times, and they have to make sure they put how they are feeling, how their skin looks, if they wake up with the acne flare, if there is no acne, and they have to pay more attention. I empower them to realize that they actually have a lot of control in this situation, and they have to look at, wait, I wake up with acne I woke up with acne on Thursday morning. And I'm like, well, what did you eat the night before? And they're like, what? And I'm like, yeah, what did you eat the night before? Oh, I went out with my friends and I had a few beers. And I'm like, oh, okay. So you are eating and some things that your body's not reacting well to. Let's look at those things. Oh, and it happened again on this other day. Interesting. The same food is causing you to wake up with your skin itchy, or you're having another lesion. So looking at their diet and what is actually causing them to have a reaction, and not just going for the catch-all like it's always gluten or always dairy, because it could be almonds, it could be bananas, it could be gluten and dairy, but it could be so many other things.
I think this is really interesting. I mean, Hadar, wouldn't you be interested, just if we could collect this kind of data on everyone and put it together through some sort of artificial intelligence kind of a program? And just, I mean, how many other things could we capture besides the standard things that we talk about? Dejarra, you're so right. Sometimes we focus on these two major groups where there's a lot of research being done, but what about the individual? What about their flares? That's a very
Right,
interesting.
absolutely. Yeah, absolutely. And actually, a couple of thoughts that came to mind. First of all, from our conversations here on the podcast, we talked to various alternative practitioners. And it sounds very interesting to me that a lot of the ancient disciplines in medicine really focused on the gut. So when we talk to traditional Chinese medicine practitioners, they start always with diet. I believe Ayurveda also puts a strong emphasis on that.
Oh, absolutely.
I don't want to make any assumptions in the presence of Raja here, but
No, absolutely true. Absolutely.
And so it's very interesting to me that when we are doing our intake in dermatology and on the allopathic side, we tend to ignore that, with some exceptions, of course. When there are some diseases that in our teaching is really focused on some diet, then we really leave that to the end, if at all. So that's one observation, that maybe it's a weakness in what we do, and maybe we should improve on that and try to figure out the diet. Part of it is probably the poor nutrition training that we get in medical school, so we don't really know what to do with that information necessarily. And the other thing that I noted from the way you do these diaries, there's actually a statistical method to this. Those are called N-of-1 studies, where you can actually leverage that into a management protocol, and in a crossover study kind of do that per patient if you had the time, right? So that's a real methodology out there, and there's a lot of people who support that to treat those people who fall outside of the mean, if you will, which is those are the people I think you're talking about, Dejarra, when you say it's not always gluten and such. But with that in mind, I wanted to move maybe towards the management part of it. And when you talk about acne, we can talk about eczema, but when you look at a person's history, how do you resolve these findings that come up through these journals?
Well, looking at the journals and also possibly doing food sensitivity testing, I send them to their allergist is another thing that I do. And I bring this all together because we need, a plethora of information, because there's no one test that can be 100% accurate. So I look at food sensitivity panels, which are widely done in the allopathic community, but they're starting to gain interest in the integrative medicine community in general. And then I will send them to their allergist, definitely get their prick test in to remove any traditional IgE allergens, and then looking at their diet diary and things that they're sensitive to, and I remove those. And then we go back to healing the gut, treating the digestion. So we're going to look at what they're eating, remove those things for a period of time. Because what I tell patients is they're in an allergic state. Those are not true food allergens, because if they weren't born with it, they probably don't have an allergy. They've just developed a sensitivity to certain foods over time. And that can happen with anything. Like I said, it could be almonds, it could be bananas, it can be dairy, and it can be gluten. And if I see that there's a response, a negative response to that, we remove those foods. And then I put them on a protocol of supplements and eating clean, changing up their diet. Most people do eat a standard American diet. So removing things that we know they don't need. They don't need a lot of refined sugar. They don't need to eat that much gluten, even if they aren't gluten sensitive. They don't need a lot of bread, and just kind of putting them on a clean diet and giving them supplements that are going to facilitate the healing of their digestive system so that we can get rid of any gas or bloating, all those things that I said, those 95% of patients come in, we have to correct that. Because if they are not properly breaking down foods and absorbing nutrients, their skin won't heal, because as you know, skin is the largest detox organ. So we need to, that just lets us know that there's something. I always tell my patients, I'm pretty colloquial with my patients, and they know me. They know I do improv. They know I'm pretty silly when I can be, but I say, the skin is just letting me know there's something nasty going on inside of you. That's all that's happening. It's like something's nasty going on. We just got to clean it up. And when we clean up the insides, your skin will show that it's better. Your skin just lets us know that the body is healthy.
I love that description, Dejarra. I think that's true that, a lot of reactions, be it chemotherapy or even if you get a viral infection, many times as you kind of get through the fever portion and everything, you'll have a reaction that comes up on the skin. And perhaps this is a great transition to talk about, of course, there's the inside approach to skin health, but there's also the outside approach. And you talk about using non-irritating topicals. And can you tell us a little bit about what kind of topicals those tend to be when you do go to topicals? What's in your armamentarium?
Oh, there's so many things in there, but I try to make sure that I do have products that have vitamin E in it because vitamin E is going to be so good for helping the scarring of acne. And it's just nourishing to the skin. Vitamin C is such a great vitamin. It helps you to create collagen. So when those new skin cells are coming up, they have that support. But the most important thing that I do, honestly, is I have my patients go to the environmental working group. I don't know if you've heard of their Skin Deep cosmetic database that they have, where they rank the products and they let you know which ones are toxic and which ones have chemicals that are irritating to the skin. And the easiest thing I do is send my patients there and make them look at all of their skin products and look at the environmental working group and say, hey, this database says that this is toxic. I need to remove that. And just clean up their cabinet. We have to clean up their cosmetic cabinet and just make sure, even if I don't change out all of their products, just make sure the products they are using aren't making the situation worse, causing more inflammation. Because patients don't necessarily read the back of the ingredients labels. And so they don't know what has parabens and what has things that might just be irritating to them. So that's one of the most important things that I do. And just clean up, make sure they're using natural products, because all my skin patients generally have they're more sensitive to everything. So perfumes and dyes, you can use those and they might not bother you at all, but skin patients will react to them. And so they just have to have cleaner products than the average person.
I think reading ingredients is so, so important. I love the fact that you're talking about ingredients, because sometimes we can rely on product labels so much. And I know that sometimes, for example, if someone says something is fragrance free, they could have used a fragrance for a different reason. They could have used a classical fragrance molecule as a preservative, and now you can label it as fragrance free.
Exactly.
So there are a lot of little loopholes in there too, as well.
I tell them everything on the front is just marketing. If it's not in the box, it's not, they're not required to, they can lie anywhere else on the bottle except in the little box. That's what I tell my patients. Everything else is marketing. So just read what's inside the ingredients box and you'll know for sure. And if you don't know, bring it to your next appointment. I'll evaluate. So during that appointment, I do evaluate their cosmetics. They bring them in, which is part of this hour, right? So I'm doing the physical exam. I'm getting a great timeline of when all the rashes start, what they eat exactly for dinner, doing a diet recall. Then I say, okay, let's pull out your medicines, but then they also bring out their cosmetics. So I look over their, medication bottles, and I also look over their cosmetics and look at, well, what is your skin regimen? And if they don't have one, I create one for them. And if they do, I just clean it up.
Well, Dejarra, thank you so much. What I wanted to touch on is one important principle that I think you mentioned, which really ties in the training of naturopathic doctors, as well as some of the concepts you mentioned. And you kept saying, I clean it up for my patient. I create a regimen for them, and I spend a lot of time explaining to them, and I give them resources. And I think that all comes back to the concept that is pretty strong in naturopathy, which is the physician as a coach and as a teacher. Can you explain to us how you do this? What kind of tools you use when you consult a patient in front of you to be that best teacher that naturopaths are so famous for?
Yes, and that's one of the principles of naturopathic medicine, which is docere, doctor is teacher. And one of, I guess, just spending time and meeting them where they are is one of the things that I feel is the greatest strength. And I don't know if all doctors feel that way about what they do, but I feel like you have to assess the patient's willingness for change. And that's the motivational interviewing, and just kind of seeing, okay, where are you? Do you want to go all natural? Do you want to change your diet? Do you feel strong enough to do this? What are the, we have to look at social determinants of health. Like what is their home like? Like, can they, if you're a working mom and you have 5 kids and your husband works too, and none of them want to eat healthy, it's going to be difficult for you to make 2 meals. So then I have to actually talk to them and say, well, what is the likelihood of you being able to change your diet? What's the likelihood of you being able to remove certain foods? Do you have time at all for self-care, or to even clean your face at night before you go to bed? Or do you have to put the kids to bed? So looking at, like, really, what is your lifestyle? And that's what I'm doing in that hour, getting a sense of who this patient is, who is this person, and how can I meet them halfway? And so that's why sometimes I can overhaul their diet completely, put them on supplements and send them out the door. And then sometimes we have to say, okay, where can we start? can we just get you to drink more water because you don't drink enough water? Let's do that for the next 2 weeks and then we'll reconvene. Maybe we just want you to eat 2 servings of vegetables at every meal. And can you
Right.
get your family to do that? So the protocol is going to be based on the patient, and it's going to be individualized for that patient based on their lifestyle and what I've discovered through the intake, the physical exam and testing that they need. And then once I get all the information on what they need, I have to produce a treatment protocol that's actually doable, because you can come up with the best treatment protocol, but if there's no compliance, there's no healing. So that's kind of where I have to be with each patient.
Well, thank you. That was wonderful. Meeting the patient where they are, I think it's a common theme that we hear from a lot of our practitioners who practice integrative dermatology. And certainly naturopathic physicians are well known for their coaching skills, probably because they have a lot of time also to do that training. But certainly we learned so much in just a short amount of time here about being a coach and about ingredients and creating diet journals and a lot of good stuff here. I wanted to just mention to our listeners that Dejarra is not going away. She'll be coming to our Integrative Dermatology Symposium coming right up in October at Coronado Island. And I welcome everybody to listen to her
Yes,
talk.
we're excited.
I'm so excited. I'm so excited.
Yes, we're excited.
Yes,
I'm excited for the talks. I'm excited for the weather. I'm excited for Coronado Island, but I'm most excited for the faculty, Dejarra. We're really excited about it.
Yes, we have a spectacular list, and Dejarra is certainly up there as one of the rising stars in naturopathic dermatology. So with that, I would like to thank you for educating us, and I'm looking forward to seeing you at Coronado Island.
Yes, thank you so much for having me, and I'm so excited to see you guys there.
Thank you for tuning into the Learnskin podcast with Dr. Raja and Dr. Hadar. We would like to take this moment to tell you about our upcoming second annual Integrative Dermatology Symposium to be held at the Coronado Island Marriott in San Diego, California. This program is an educational experience jam-packed with information, including case-based discussions and multiple perspectives on topics such as psoriasis, atopic dermatitis, diet and skin microbiome, cannabinoids, hair loss, traditional Chinese medicine, and much, much more. Go to www.integrativedermatologysymposium.com and register today. We look forward to seeing you there.